So let me tell you a story. A couple of months ago, my mom, who is 81 years old, fell down a flight of stairs in the middle of the night, and it was a horrific fall. She broke about 9 bones, cracked her skull. It was terrifying, and the fact that she didn't die is a complete and total miracle. And she was in the hospital for 2 weeks and then in a rehab for about 3 weeks. She's still recovering, but she's largely there. The reason I tell you this story is because when my mom had to go into the rehab, me and my siblings had our first experience of really having to navigate the sort of healthcare for seniors labyrinth that is the United States. And one of the things that we found out that was quite shocking was that full-time home healthcare is not covered under Medicare. And we just assumed that it would be, and it's not. So we're really lucky that my mom got better as quickly as she did. But had she needed extended home health care, and in the future she very much still could, I don't know how we would have paid for it, even the 4 of us together. So this morning when I found out that Kamala Harris had released this new policy proposal saying that Medicare would cover senior care at home, I was like, yes. Yes, that is unbelievable. This is what we're talking about when we talk about a care economy, because this is the kind of thing that you go to European countries, this is covered. This stuff is covered. They don't worry about stuff like this, whereas people in this country think, what will I do? If my mom is home and I've got to stop working to take care of her, I don't have paid family leave, and I also, I can't afford to hire someone to come in. That's what this policy is meant to cover. Oh, and also, did you know that right now Medicare doesn't cover hearing or vision? And under her proposal, it would, which 90% of seniors need. Add this to her already amazing policy proposals, the $6,000 child tax credit for newborns and the $3,500 child tax credit for everybody else. All of the other things she's proposing, what she's trying to do is make it so that we can care for each other, but that when we can't, someone else can, so that the people we love get the care they need. And before you say, oh, well, how's she going to pay for it? It's going to make the deficit go up. Oh, did you not see the news article this week that said that Donald Trump's policies will add twice as much to the deficit as Kamala Harris's? Twice as much. Why? Because Donald Trump is going to cut taxes for rich people. Cut, and add trillions of dollars to our deficit so that Elon Musk can have a few more yachts, literally. So basically, his care economy is care for the billionaires and the rest of us gets shafted. That's what happened last time. When he was president, he sought to make cuts to Medicare and Medicaid in every single year of his presidency. Kamala Harris wants to go another way. She wants to raise taxes on rich people to help pay for these programs. And in the case of this new Medicare policy that she's talking about, how is she going to pay for it? By continuing to let Medicare negotiate the price of drugs, which is a policy that was instituted under Joe Biden through the Inflation Reduction Act that not a single Republican voted for. Okay? And that policy, if 10 drugs are going to be negotiated way down, it's saving Americans tons of money. But it's also saving Medicare money. That's money they don't have to pay out. And with those savings, they want to offer more services, like having someone come into the house and take care of your parent. Because I'll tell you something, the one thing my mom said when she was in that rehab facility, over and over again, I want to go home. Imagine if you could say, Mom, you can. What a world that would be.